Hello everyone, I'm Dr. Piao. Welcome to this mini integrative medicine lecture on insomnia from a traditional Chinese medicine perspective. And this session is designed specifically for practicing TCM physicians, acupuncturists, and integrative medicine clinicians. Our goal is to move beyond basic theory and provide evidence-based clinical insights into acupuncture and herbal medicine strategies. Let's begin by examining the clinical importance of this condition in our daily practice. As practitioners, we encounter sleep disturbances with high clinical frequency, often as a primary complaint or a complicating factor in other chronic diseases. Insomnia is rarely an isolated issue. It is a complex systemic manifestation indicating deeper disharmony. Poor sleep significantly impairs a patient's overall recovery and resilience. However, this also presents a profound opportunity for TCM intervention. By addressing the root cause of the sleep disturbance, we can often unlock the healing process for the patient's broader health concerns. Building on this, we must briefly acknowledge the limitations of conventional treatment. While Western medicine offers valuable short-term symptom management, pharmacologic interventions frequently come with side effects such as daytime grogginess or cognitive impairment. More importantly, there is a well-documented risk of tolerance and long-term dependence. These limitations highlight a critical gap in care, a gap that TCM is uniquely positioned to fill. Our focus must remain on root cause resolution rather than mere symptom suppression, which leads us directly to our understanding of pathogenesis. From a traditional Chinese medicine perspective, insomnia is fundamentally related to imbalance of yin and yang and disturbance of the Shen. Sleep is bound by the heart, while the kidney provides foundational yin to anchor yang during the night. When heart and kidney lose coordination, sleep becomes unstable. Liver qi dysregulation, often associated with stress and emotional disturbance, may further disrupt Shen and impair sleep onset. In chronic cases, blood and yin deficiency may fail to nourish the heart, resulting in light sleep, frequent awakenings, or early morning waking. Therefore, insomnia in TCM is understood as a systemic imbalance rather than an isolated symptom. This leads naturally to our TCM clinical framework. The cornerstone of our approach is precise pattern differentiation. We are not treating insomnia as a monolithic disease. We are treating the specific disharmony presenting in the individual. The overarching goal is harmonizing yin and yang, specifically anchoring the yang so it can return to the yin at night. Central to this is regulating the Shen, ensuring it has a peaceful residence. This framework demands an individualized treatment strategy, dynamically adjusted as the patient's clinical presentation evolves. We can now turn to acupuncture strategies from a traditional Chinese medicine perspective. In TCM, insomnia is primarily treated by regulating yin and yang and calming the Shen. The goal is to restore internal balance and allow the Shen to return to its natural state at night. When heart-kidney disharmony is present, acupuncture may help harmonize the upper and the lower axis, supporting sleep stability. In cases related to liver qi dysregulation, treatment focuses on soothing liver qi and reducing internal tension that interferes with sleep onset. For deficiency patterns, especially blood and yin deficiency, acupuncture aims to nourish yin and support the heart's ability to house the Shen. From a modern research perspective, acupuncture may also influence autonomic nervous system regulation, helping shift from sympathetic dominance toward parasympathetic activity, which supports sleep and relaxation. To execute this strategy, we rely on a core set of common acupuncture points. Heart 7, Shenmen, is our key point for Shen regulation, essential in almost all insomnia cases. 220, Bai Hui, is crucial for anchoring ascending yang and clearing the head. Spleen 6, San Jiao, is indispensable for nourishing the three yin meridians, particularly when blood or yin deficiency is present. The empirical point, Anmian, is highly effective for inducing sleep. Finally, pericardium 6, 内关, harmonizes the yin, soothing the chest and calming emotional turbulence. Alongside acupuncture, our herbal strategy relies on synergistic formula construction. The principle is to address the root deficiency or axis while simultaneously calming the spirit. A key tactic is using guide herbs to direct the formula's action specifically to the heart meridian, where the Shen resides. It is vital that the herbal strategy remains flexible as the patient's condition improves. For example, as liver fire is cleared, the formula must adapt to focus more on nourishing the newly exposed underlying deficiencies. Let's briefly review several commonly used formulas. 酸枣仁汤 is commonly used for liver blood deficiency associated with sleep disturbance. 黄连温胆汤 may be considered when flame heat patterns are present. 归脾汤 is often used in spleen heart deficiency with fatigue and overthinking. For complex presentations involving liver and gallbladder heat with Shen disturbance, 柴胡加龙骨牡蛎汤 may be considered based on pattern differentiation. These formulas are typically selected based on individualized clinical assessment. While our foundation is traditional, understanding biological mechanisms may help support clinical reasoning. Both acupuncture and herbal strategies may enhance the GABA system, promoting central nervous system inhibition necessary for sleep. They may also modulate serotonin pathways, which are important for sleep regulation. Furthermore, these interventions may help regulate the HPA axis, reducing cortisol fluctuations associated with nighttime awakenings. Emerging research also suggests potential effects on neuroplasticity and brain network stabilization, which may help explain sustained clinical benefits compared with conventional sedative medications. This brings us to the evidence-based support for our practice. The efficacy of TCM for insomnia is no longer anecdotal. It is backed by robust systemic reviews and meta-analysis. Recent high-quality studies constantly confirm that acupuncture and specific herbal formulas significantly improve sleep quality indices and total sleep time. Importantly, this evidence is leading to the integration of TCM modalities into broader clinical guidelines. Furthermore, modern research is beginning to validate our TCM pattern approaches, showing that treatment tailored to specific differentiations yield superior clinical outcomes. In summary, traditional Chinese medicine offers profound clinical value in the treatment of insomnia. The key to our success lies in rigorous pattern differentiation, moving beyond generic protocols. By intelligently integrating targeted acupuncture strategies with synergistic herbal formulas, we can address the root causes of sleep disturbances. As senior practitioners, grounding our traditional wisdom in an evidence-informed practice not only elevates the standard of care we provide, but also solidifies the role of TCM in modern integrative medicine. Thank you for watching. I hope these insights may be helpful for clinical practice.